Hi, I'm Ann Vaillancourt from Female Menopause Mentors, and I'd like to take a couple minutes today to talk to you about what I feel women should be aware of as they begin to experience menopausal symptoms. Menopause usually occurs sometime in the mid-40s and can last upwards into the 50s. It can take about 10 years to get through the entire process of menopause, but many of the first symptoms that women will notice will be an irregularity of their period. Their cycle may get closer together, and then it may lengthen out and you may start skipping months. It's also not unusual for you to notice a different bleeding pattern through your menses, with a heavier day occurring a little later on in the week than what you're used to. These would most likely be considered all normal symptoms. Menopause is occurring because the ovaries are no longer producing estrogen and the hormones that regulate ovulation in the same pattern or the same amount as what they have throughout your menstrual life. So you begin to have a lot of the symptoms. Along with the irregularity of the periods often comes some hot flashes, sleep disturbance, often from hot flashes, fatigue, as well as sometimes a decline in memory or a feeling that you are becoming more forgetful. This symptom can be particularly troubling in women who have a family history of dementia. Oftentimes patients come to me with concerns that they too are developing dementia, but it's not unusual to become a little forgetful, and this is usually occurring because the estrogen levels are fluctuating. After you're through with menopause and estrogen levels, although they're lower, become much more stable, many of these symptoms go away. Menopause occurs when there has been 12 consecutive months of no period. So everything prior to this point of time is considered perimenopause, and everything after is, of course, postmenopause. Perimenopause is when you'll experience the bulk of symptoms. So many patients say to me, what should I do? What do I need to do now that I'm perimenopausal? First thing I say is to get a good exam by your medical provider and outline or know what your risk factors are for heart disease, cancer. The incidence and risk of heart disease and cancer goes up as we all age, and menopause in particular can accelerate the risk for heart disease. So it's important to get a good exam and know what your blood pressure is, your glucose, your cholesterol, know what your BMI is, and control your weight. That will help reduce your risk of developing heart disease and diabetes. It's also good to partake with the cancer screening tests that are recommended. A yearly pap smear, sometimes every third year, is appropriate. This will screen you for cervical cancer, and in some cases may pick up uterine cancer. It's also important to get regular mammograms and do your own self-breast exams. This has been controversial and in the news lately, but I personally am an advocate of monthly self-breast exams and yearly mammograms after 50, perhaps yearly between 40 and 50. Many of my own patients have found their own cancers. It's important to talk to your provider about everything that you're experiencing. Many things you'll be told are normal. Some things may not be normal. A heavy bleeding pattern may not be normal if you have fibroids or overgrowth of your endometrial tissue. This can be a precursor to uterine cancer. It may not be normal if you're having diarrhea or bloating. This could be a signal of colon cancer, and in some cases can precede an ovarian cancer by a few years. So it's important to be honest with your provider about everything you're experiencing. Don't be shy. Bring it up yourself if your provider doesn't ask you. Lastly, I want to mention skin. It's important to do your own skin check. Get get a family member to help you with your back, to look at your back, and make sure that your provider does a yearly skin exam or refers you to a dermatologist for that to be done, especially if there's a strong family history. Lastly, it's important to achieve a balance through menopause. There's a lot of changes going on. They can be upsetting. They can make you feel like you're not in control. So you really need to take the time to take care of yourself. Think about your diet, think about your activity level, get a little exercise, but most of all, relax. Don't burn the candle at both ends. You can do that when you're young, but your body's getting older, it's going through some changes, and it needs some time for you to relax and for you to de-stress. Do the things that you enjoy, do the things that feed your soul, have fun, and you can get through this hopefully with a minimum of discomfort. Thank you.